Thank you, Madam Chair, and thank you, Ranking Member Fleischman. Thank you, Secretary, for coming before us today to answer our questions. And I know the timing of this hearing is incredibly important given the chaos that's happening at our southern border right now. We know those numbers from March were well over 200,000 encounters with illegal immigrants, a 500% increase over 2020, incredibly alarming to me. In our communities, I just did a town hall last week, heard from our local law enforcement. They see the federal government as failing at its mission at the southern border, and they are having to deploy resources locally to counter for that. It's frustrating to me that I feel like here we are again after a year. We were giving these warnings a year ago about the situations, not only at our border communities, for our law enforcement officers, not only down in Texas, but in places like Iowa, who continue to raise the alarm that this crisis has worsened. And so I think this is a direct result, the compounding that we're seeing at our southern border of this problem of this administration's policies. I think it's ludicrous that you're saying comprehensive and deliberate strategy since January of 2021, and yet here we are with a worsening and compounding crisis at our southern border. So I had a chance to visit the southern border last April. I had a chance to connect with Customs and Border Patrol agents in the Del Rio sector. We know Title 42 has been a very useful tool for Border Patrol to help process people at our southern border. I heard that directly from agents. They were asking for this to be permanent. I think if our president and our vice president also had a chance to go down and see this in person, they would hear that directly from them as well. So I would ask you to convey that to the president and the vice president, that they need to go see it in person as well. Because of this policy, we're hearing from the DHS Inspector General. General Kafari was before our committee a few weeks ago as well. He said there are 100,000 migrants waiting for this policy to end, just sitting there. We know that number is going to increase as well. And when we see Border Patrol being severely undermanned, and I know you're asking for more agents, but when 60% of them are not doing their job as intended, that's a huge hole. So have you talked to Border Patrol agents on the ground at our southern border? What are they telling you about the end of Title 42 and the anticipation of that policy changing? We'd be interested in what you're hearing from the agents.
Congresswoman, thank you so very much. Of course, I have much to say in response to the statements that preceded your question, but allow me to respectfully disagree with much of what you said and to just answer your question. As I said earlier this morning before this committee, I visited the border 8 times now in my role as secretary, and I had visited it previously in my role as the deputy secretary and in other capacities throughout my more than 20 years in federal service. The Border Patrol agents are doing their job every single day. We need to get them out in the field to interdict individuals who are seeking to cross our border illegally, and that is why, as I've said previously, we're really ramping up the case processing capabilities to get those Border Patrol agents out in the field. Some certainly have said to me that Title 42 has been of utility to them, despite the level of recidivism that Title 42 can prompt. Because please remember that under Title 42, individuals are expelled, they're not formally removed in immigration proceedings, and therefore they do not have a record of removal. And what we are seeing is the number of encounters, not necessarily the number of unique individuals reflected in the numbers that you have cited. But some of them have certainly requested that Title 42 remain, and I have explained to them, as I have shared with this committee, that the law provides that that is a public health authority, not an immigration policy, and the CDC controls the exercise of that authority according to its assessment of the public health need.
So if CBP is understaffed and agents are in many of these cases coming to you and saying, hey, we probably need this policy to be permanent, how does this work with ICE? We know ICE beds are underutilized right now. These agencies should be working together to handle this increased influx. What are we doing with the additional ICE beds and the detention beds for the people who are being brought into a country and who are not being expelled quickly?
Congresswoman, U.S. Customs and Border Protection and Immigration and Customs Enforcement are working hand in glove as part of the SBCC, the Southern Border Coordinating Center, and they have worked hand in glove before I directed the creation of that center. Detention is being used in furtherance of our prosecution efforts. We focus our detention resources on the greatest public safety, national security, and border security threats. That is where we have the greatest law enforcement impact, and we continue to exercise our detention authority, our prosecution authorities in the service of those three primary goals.